Welcome to the Healthy Happy Human Show. This is one of a kind.
Hello everyone, welcome to a very exciting episode of the Healthy Happy Human Show.
The Healthy Happy Human Show is here to help you attain physical, emotional, and mental well-being.
Okay, hello everyone, welcome to a very special episode of the Healthy Happy Human Show. So we are going to be talking about stroke today. We have a very special guest in our midst. So I want you guys to welcome our special guest for today.
Okay, thank you for having me today. I'm Dr. Daniel Ikere. I'm currently a practicing doctor of medicine in Nigeria, and I'm very happy to be on this show today. Thank you very much.
Okay, so for today I'm your host. You can call me Dr. Flash. Okay, thank you. So today we are speaking about stroke. So what exactly is stroke? What should come to people's mind when they hear the word stroke? Okay,
so stroke is something that a lot of us have heard about. We have different ideas on what it is. Well, in a simple way to explain it is that stroke is something that occurs when blood flow to a particular part of the brain is obstructed. So this obstruction could either be something blocking the artery that takes blood to that part of the vein, or that artery rupturing or burst. It's like a pipe. So if it bursts open, blood will no longer flow to the required destination. Okay. So that's where we have a stroke.
Wow, that's very interesting. So what are the things that can put people at risk of having stroke, or what are the things that people should avoid, or these are the things that can make people to come down with stroke?
Okay, so like I just said now, stroke, as I just explained, is something that occurs mainly due to a vascular origin, so something affecting the arteries or the veins of the brain. And one of the major factors in this is hypertension. Normally, I like to differentiate them. Some are modifiable, some are non-modifiable, some things you can change yourself. Hypertension is number one on the list of things that you yourself can work on.
Okay.
So uncontrolled blood pressure is number one. Okay. Number two, cases of diabetes mellitus. Okay. Uncontrolled blood sugar is another risk factor of stroke. You also have, for instance, someone that has, you hear this thing, high cholesterol. Yes, yes, high cholesterol. That's another risk factor for stroke. So excessive weight gain, obesity, sedentary lifestyle, so you're not doing anything, you're just sitting around, relaxing, no exercise, poor diet, all of this can build up and cause the bad cholesterol.
And then they can put people at risk.
Put you at risk, yes.
Okay.
So even use of medications, some medications can also put you at risk of stroke. And then one very important one, use of hard drugs. Yes, the cocaine and things like that. They are very dangerous and harmful. They can lead you to having a stroke. Yes.
Okay, you have mentioned a lot of things and very interesting. These are things that are very common in our society. So first of all, moving forward, I want to know when we can say someone is in danger of stroke. What are the danger signs that if you see these things, you know that you need to see a doctor immediately?
Okay, I'm going to give you a little story before I go into this.
Okay.
So, I had this patient not very long ago, presented to me with very uncontrollable blood pressure. The blood pressure was about 320.
Jesus.
And we had to use a mercury sphygmanometer, and even then we're struggling to determine what the blood pressure was.
Okay.
So, this kind of patient, he's very high risk of developing a stroke suddenly. And one of the things that you have to notice when people are developing strokes, somebody comes down with severe headache, very severe headache, loss of feeling in one half of the body, loss of sensation. The person is unable to move the arms or the legs suddenly. The person just suddenly goes blind in one eye. It might be temporary, because we have what they call a transient ischemic attack, a very temporary situation that is similar to a stroke. If someone has that kind of situation, there's a very high probability you have a stroke occurring very soon.
Okay.
Yes.
Okay, so that's very important. Thank you very much for sharing that with us. So we want to know, like, what can we do for such people? Like, if someone comes down with a stroke,
Yes.
like, is there hope for such person?
Okay. So when someone starts developing symptoms of stroke, there's this program that has been started in 2011.
Okay.
And it allows you to quickly identify what are the symptoms that this person is having, and you are able to respond quickly to it.
Okay.
It follows an algorithm known as FAST, F-A-S-T, with the F there standing for facial asymmetry. So what you are looking for is this person's face. Is he shifted to one side? When this person is smiling at you, is one part of the face dropping?
Okay.
Is it that he's smiling and he cannot smile well again? You are looking for the arms and the legs. Can he not move one arm and one leg? Is it that he doesn't have sensation in that side? You are checking his speech, S. When he's talking to you, is his speech slurring? Like he don't understand what he's saying, or he doesn't even understand you. Yes. And then all of this come down to the T there, which is timing.
Okay.
So as soon as you notice these things, call for emergency care immediately, or take this person to the nearest hospital facility.
Okay.
You can. Yes.
Thank you very much. Quite enlightening what you are sharing with us today. So what are like the chances for people who come down with stroke? Like, is there hope in case someone comes down with stroke? Like, what are their chances?
Okay. So in a study that was done recently, we found out that 1 in 4 people that have a stroke are likely to die within a year. It seems quite a lot.
That's alarming.
Yes, it's alarming. That's why we try to push for methods to reduce the incidence of stroke.
Okay.
Yes, and we also have this FAST that I just spoke about that will help you identify and prompt treatment. Okay. So if 1 in 4 people die within a year, the remaining 75% of people involved, we found out that 50% of those people, about 50%, make a full recovery.
Okay.
Yes, the symptoms of the stroke, the paralysis, the blindness, everything might be gone within a year period completely. And then we find out that in the remaining percentage of people, the symptoms are usually present temporarily for a longer period, or they may be permanent for a lifetime. Yes, and it's also possible that this group can have a recurring stroke occurring over time. Yes.
Wow. Wow.
Yes.
Okay. Thank you very much, Dr. Daniel. Any last words, like advice for people out there, you know, to...
Okay. Okay, I'm going to speak about my people in my own environment that I'm used to.
Okay.
One thing I would like to encourage is good health seeking.
Okay.
See a doctor, not just only when you are sick. It's always, medicine is best when it's done preventive over reactive. So we are preventing something from occurring instead of reacting to it occurring.
Yes.
So if you are seeing your doctor regularly, you have a problem, blood pressure issues, we can control them rather than you just allowing it to fester and then develop into something else. Another thing we advise is, if you have high blood pressure, please see a doctor, take your medications, let your blood pressure be controlled. Your diet, eat healthy foods, fresh foods, fruits, vegetables. Exercise is very important.
Okay.
Yes.
I need to start exercising. Okay. Yeah. Thank you very much for that one.
And one of my go-to is drink a lot of water.
Okay.
Yes, it helps you. It keeps you hydrated. It allows your body to function well. And I think that's it.
Thank you very much. I really appreciate your presence here today, Dr. Daniel. I believe someone out there has heard something that is very important about their health, and people should always look out for some of these danger signs. Yes. And if you're experiencing any of them, it's very right and pertinent that you see your medical practitioner. So we understand that there might be some challenges of people not, having readily available health care.
Yes.
But in as much as we have such challenges, but if you are able to, if you have your means, you should always check in with the doctor from time to time?
No, you don't even always have to go to the hospital to check your blood pressure. In a lot of the pharmacies around, you can have a blood pressure check done for you, and you can also get your own little blood pressure machine at home.
Okay.
Yes.
All right. Thank you very much.
Thank you.
We hope this session is very useful to someone out there. And please give us feedback, ask your questions in the comment section if you have anything to say. Thank you very much. So, signing out.